it's hard to see the real economy just snapping back. We've talked on this show about an 80% economy where the marginal consumer doesn't come back to certain endeavors until there's a vaccine. And I think that that's a possibility here, that you're going to have 80% of the economy restored, but restaurants aren't going to be booming, entertainment venues aren't going to be booming, movie theaters aren't going to be booming, amusement parks. And that's an important part of the economy when you look at the hospitality segment of this economy, as well as some office work isn't going to get fully restored until we get to a better place with the spread of this virus. And we're likely to have persistent spread through the summer, at least enough to keep the marginal consumer more at home than they otherwise would have been. And in looking to the fall, I think we really face the prospect of another cycle with this virus. The good news is we're going to get to the other side of this. There will be a technological solution. We will have a vaccine. We're going to get to herd immunity. We're going to put this behind us. But I think we need to contend with persistent spread through this summer and in one more cycle with this in the fall. And whether or not that's just large outbreaks and pervasive spread, or we experience a true second wave of an epidemic, hard to tell right now. But this is going to be with us for a while.
Well, one of the issues, the epidemic, as you discuss it, it continues to expand as we speak. And you cited today a Morgan Stanley study which said so in terms of the number of new cases we're seeing every day, which are probably, as you suggested last night, still underreported.
Right. And if you look state by state, you see states that have expanding epidemics: Arizona, Texas, Arkansas, North Carolina, Wisconsin, Minnesota. You're seeing cases, Georgia, you're seeing cases go up, hospitalizations go up. And the most concerning thing is to see that hospitalization data go up. And so at this point in this cycle, in this epidemic, we should have been coming down the curve more aggressively. And what Morgan Stanley cited was, relative to other nations, we've had sort of persistent spread, this persistent plateau, and we really haven't crushed the virus. And because we haven't crushed the virus, heading into the fall, we're going to have a lot of infection here that's going to be the conduit for outbreaks and spread going into the fall. So we have a much more dangerous platform that we're coming off of. I don't think we're going to have a major outbreak this summer. I think we're going to get that breather that we talked about, because there is a seasonal effect here. But what the seasonal effect is basically going to do is mitigate the spread that's already underway. So maybe it's a wash. Maybe we continue with 20,000 infections a day that we're turning over, but we never really get below that. That's a distinct possibility. And if we take 20,000 infections a day into the fall, which, as you said, is really probably 200,000 infections, because we're not diagnosing a lot of mild and asymptomatic infections, it's a lot of infection around the country to ignite chains of transmission and potentially a new epidemic. I don't know that I don't do market commentary and look at how the markets are discounting future risk, but it doesn't feel like the market's fully discounting that future risk right now, looking out to the fall.
I don't know. You may have a career as a market analyst as well on the backside of this. You're doing pretty well with that. Let's talk about what the CDC said today. Said it's, quote, very concerned that its warnings aren't being heeded about distance and masks. So I'm wondering your feelings about what the CDC had to say today, and frankly, the fact that the CDC had anything to say today, Dr. Gottlieb, because the fact of the matter is we haven't heard very much from the CDC of late.
Well, the CDC director, Bob Redfield, a friend of mine, testified before Congress today. I think the point about masks is very real. The incremental information that we've gotten in subsequent data shows that universal masking really seems to help reduce spread. And so if we can get more people wearing masks, it could reduce the epidemic here. One study came out and said that if 60% of people wear a mask that's 60% effective, you could effectively get the reproduction rate, below 1, which means instead of an expanding epidemic, you have a contracting epidemic. You've basically started to shrink the scope of spread. I think what the problem is, we're dealing with a population that a lot of people are just exhausted. We've been inside for 3 months. We've been social distancing. And a lot of people are getting exhausted by these measures. And so you're going to see some natural relaxation among individuals who just don't do the same things that they've done before. And we need to bake that into our public health assumptions. If we're being rational from a public health standpoint, we need to understand it's hard to keep this going for 6 or 12 months in a row. And that's why you see sort of a phased reopening and trying to reintroduce things that improve quality of life and give people a sense of normalcy about their lives. But there's certain things that we should just try to continue to do. And I think the masking is one of those things. It's not that hard to remember to wear a mask and try to wear it when you're out in public and in groups. And that's one intervention, a fairly simple intervention, a fairly inexpensive intervention that could probably have a big impact.